The neccropsy procedure begins with a thorough external examination. Begin the exam at the head and work caudally, following a systematic order to ensure nothing is missed. Visually inspect the head, comparing both sides for symmetry. Look for staining around the nares and mouth, indicating respiratory exudate. Palpate the skull for fractures and other abnormalities by wrapping your fingers around the base of the skull and running your thumbs up and over the crown, around the orbits, and under the beak. The eyelids should be clean, dry, and free of exudate and adhesion. Open the eyelids and inspect the eyes. The cornea should be clear and convex, and the sclera white. Look for abnormalities like corneal opacities caused by edema, exudate, ulcers, or erosions. Neovascularization can result from inflammation and healing. The pupil should be round and the iris uniform in shape and color. Iris color varies with the breed and color of the bird. However, infections can produce redness, cataracts, or exudate in the anterior chamber. Light discoloration signifies cellular infiltration caused by some neoplastic diseases like Marek's disease. Examine the external eyelids for swelling or discharge. Grasp the lids and evert them to visualize the conjunctival sac and membranes. These mucous membranes should be light pink in color and free of any swelling or exudate. Red membranes may indicate inflammation or infection. Embedded in the mucosal surface of the conjunctiva are aggregates of lymphoid tissue. These aggregates are generally not visible on gross necropsy, but may swell or become reddened during disease. Additionally, the Harderian gland is located in the ventral medial aspect of the orbit. This is a mixed gland consisting of secretory and lymphoid elements. If the gland becomes enlarged during disease, the tissue may become pink and the third eyelid may be partially prolapsed. The third eyelid may also be affected in cases of ocular aspergillosis and Oxyspirura mansoni infections. Examine the external ears, located caudal ventral to the eyes. The ears are located under short, stiff, covert feathers. The ears are simple round ostia with no external pinna. The openings should be free of swelling, exudate, or other material. Examine the beak and cere. A properly formed beak is bilaterally symmetrical, and the upper and lower halves should form a smooth line where they articulate. Nutritional imbalances may result in beak abnormalities. The color of the beak depends on the bird's coloration, with lighter birds typically having yellow beaks. However, beak color can also be influenced by physiologic factors. For example, yellow pigment in the beak may be lost as the chicken produces more eggs. In ducks and other birds, hormonal changes may also affect the color of the beak. Open the mouth and examine the oral cavity. Pull out the tongue and examine its dorsal and ventral surfaces. A bird's tongue is supported by the hyobranchial apparatus, making it somewhat inflexible. The dorsal surface of a chicken's tongue is smooth, and there is a row of large papillae near its caudal attachment. Inspect the tongue for any lesions, such as ulcers or nodules. Inspect the oral pharynx for any lesions. Note that birds do not have a soft palate or a discrete boundary between the oral cavity and the pharynx. On the roof of the oral pharynx is a fissure, called the choana, which opens into the nasal cavity. Inspect the area around the choana for ulcers. The choana is also a good place to find respiratory exudate. Birds do not form liquid pus, and inspissated exudate tends to accumulate in the choanal orifice. If exudate is present, you can collect a swab sample from the choana or trachea at this time. Just caudal to the choana is the infundibular cleft. This is the opening to the eustachian tube, and is surrounded by ridges and rows of sharp, well-demarcated papillae that point caudally. A variety of diseases can damage the papillae, resulting in blunting. Inspect the color and consistency of the oral mucosa. Keep in mind that lighter birds will have a pink mucosa, and darker birds will have more pigment. Look for ulcers, erosions, opacities, diphtheritic nodules, or other lesions. Examine the comb and wattles. The size of the comb will vary, with the combs of males tending to be larger than those of females, and the combs of younger birds smaller than those of older birds. These outgrowths of skin are highly vascularized, making them a useful way to assess the bird's overall health. The comb and wattles are normally bright red. After death, their color will quickly fade, but they should remain firm and uniform on palpation. Abnormalities may include edema, petechiae, necrosis and cyanosis, cutaneous papules, and ulcers. Evaluate the infraorbital sinuses. The sinuses are triangular-shaped cavities located rostroventral to the eyes. The sinus is normally an air-filled lumen, with one opening into the nasal cavity and the other into the caudal nasal concha. Depress the area over each sinus. If exudate is present in the sinuses, this pressure will force the exudate out the nares or medial canthus. The interior of the sinuses will be evaluated later in the exam. Place the bird in dorsal recumbency. Lightly palpate the area over the coelomic cavity, assessing the subcutaneous tissue for crepitus. Using greater pressure, palpate the keel and ribs for fractures. Finally, palpate the deeper structures in the underlying coelomic cavity, feeling for any swelling or effusion. The keel bone should also be evaluated for any deviations, which may be caused by nutritional imbalances. Assess the body condition of the bird by determining the amount of fat stored at the thoracic inlet and over the keel bone and pectoral muscles. Fat can be visually recognized as soft yellow deposits beneath the skin. However, body condition is best assessed by both visualizing and palpating the fat and muscle over the breast. In an overconditioned bird, the pectoral muscles will be covered by a thick layer of fat, making the keel difficult to feel. In a well-conditioned bird, the pectoral muscles will be flush with the ventral aspect of the keel. As the bird loses body condition, the muscles atrophy, and the line from the pectoral muscles to the keel becomes more concave. In a poorly conditioned bird, the pectoral muscles will be thin and the keel bone very prominent. The volume of muscle and fat will vary somewhat by breed, with meat-producing breeds having more muscle than egg-producing breeds. Turn the bird over and palpate the vertebral column, feeling for fractures and developmental defects such as spondylolithiasis, often referred to as kinky back. The vertebrae in birds are largely fused, and there should be little flexibility along the back. There are one or two free vertebrae located between the notarium and the synsacrum. Palpate this area carefully for fractures or deviations. This area can be examined more carefully from the ventral aspect once the bird has been opened and the viscera removed. Move the feathers aside and examine the skin across the entire body surface. The skin is normally very thin, and the amount of pigment varies from pink to black. The skin should be free of exudate and have little or no scale. Look for any lesions or evidence of ectoparasites. Some species of parasite inhabit the surface of the skin, while others are more likely to be found on the feather barbules. If parasites are present, they can be collected and submitted for identification. Examine the feathers. Birds have several types of feathers distributed across various regions of their body, including down, body feathers, and flight feathers. Look for abnormalities in feather conformation, such as warping or malformed barbs and barbules. pay attention to the area where the feather emerges from the follicle. Swelling in this location can be indicative of several types of infection. Make note of any body regions that are missing feathers. Feathers are normally distributed along tracts on the body called pterygi. These tracts are interspersed with featherless tracts called apteria. Keep in mind that not all feather loss is abnormal. Seasonal feather molting is a normal physiologic process. In non-pathologic feather loss, the skin will appear healthy. In cases of pathologic feather loss, such as excessive feather picking by the bird or its cage mates, the skin will be traumatized. Place the bird in ventral recumbency and examine the uropygial or preen gland located dorsal to the base of the tail. This cutaneous gland secretes an oily substance that birds spread over their feathers during preening to maintain their feathers. The body of the gland is located subcutaneously, and its two lobes can sometimes be visualized beneath the skin. The gland's duct exits externally through a small papilla. Infected glands may result in swelling and reddening of the surrounding skin. Examine the vent located just beneath the tail. The vent is the external orifice of the urinary, genital, and gastrointestinal systems. Look for fecal staining of the feathers around the vent, indicating diarrhea. Crusting of urates suggests dehydration or husbandry problems. The vent can also become lacerated or abraded by interbird aggression. Examine the wings. Begin by grasping the wings and extending the joints. The wings are normally very flexible and should easily extend outward. The right and left sides should be symmetrical. Palpate the deep structures of the wing, working systematically from the proximal aspect to the distal tips. Palpate for bony fractures, healed calluses, areas of inflammation, and other abnormalities. Palpate the pelvic bones. In birds that are in lay, the pelvis should be flexible. Birds that have not been laying should have a stiff pelvis. Examine the legs. Palpate the bones along the legs for fractures and deviations. The leg bones should be straight and symmetrical. Flex and extend all the joints to assess range of motion, keeping in mind the effects of rigor mortis. Palpate the joints for swelling or effusion. Palpate the tendons. Assess them for swelling, that may be indicative of tenosynovitis, or laxity associated with tendon rupture. Examine the musculature of the legs, noting symmetry and tone. Asymmetry in size may indicate muscle atrophy, resulting from injury or damage to the nerves of the limb. Any muscle atrophy observed during the external exam will require a close inspection of the corresponding nerves during the internal exam. Visually inspect the skin on the limbs, which is covered by scales that are normally dry, flat, and slightly overlapping. Some parasites live beneath the scales of the legs. Some infectious diseases can cause keratinous outgrowths from this skin. If these lesions are seen, they should be collected for laboratory testing and histopathology. In baby chicks, it is important to examine the legs and feet for evidence of dehydration. Dehydration results in a loss of skin turgor, which is easiest to observe on the legs of young chicks. Finally, examine the feet. Bird claws will vary depending on housing conditions. In birds housed on the floor, claws will normally come to a blunt, tapered end. Birds in cages may have sharp claws. However, the claws should not curl back on themselves or fray easily, which may indicate a nutritional imbalance. Mature males of some species have a spur, while the spur on the female is much smaller. Sometimes the spur is removed on males to prevent trauma to other birds in the facility. Flex the joints and palpate the digital pads. The pads are composed of thick skin and adipose tissue. The foot also has a large central metatarsal pad. This pad should be soft and free of scabs or swellings. If it is firm, ulcerated, or covered by a scab, the bird may have a deep infection called bumblefoot, caused by staphylococcal bacteria. This condition is associated with inappropriate substrate, and the husbandry should be evaluated. Look for any other foot abnormalities such as edema, hemorrhages, or other lesions. Once the external exam is completed, collect any necessary diagnostic samples for laboratory testing. Then, dip the bird from the neck down in a disinfectant solution. Wetting the feathers reduces the aerosolization of pathogens and makes it easier to evaluate the skin and other external structures. With the feathers wet, perform a quick reassessment of all the external features to ensure that no lesions were overlooked during the dry exam.